have told division of the neck region. We have told that anterior division of the neck consists of medial triangle, lateral triangle, and the sternocleidomastoideus region. Main vessels and nerves of the medial triangle of the neck is located in the carotid triangle. So medial triangle borders, let's remember, superiorly it is bounded by lower margin of the mandible, laterally it is bounded by anterior border of sternocleidomastoideus muscle, and medially by midline of the neck, which by hyoid bone is subdivided into suprahyoid region and infrahyoid region. In infrahyoid region, we have two carotid triangles and two homotracheal triangles. In suprahyoid region, we have two submandibular and one submental triangle. So, main vessels and nerves of the medial triangle is present in the carotid triangle. Carotid triangle is bounded superiorly by posterior belly of digastric muscle. Posteriorly, it is bounded by anterior border of sternocleidomastoideus muscle, and inferiorly by superior belly of omohyoid muscle. Carotid triangle is covered by the following layers. Superficial layers will be skin, subcutaneous dead tissue, superficial fascia, which makes compartment for platysma muscle. Platysma is also located on this layer. Below this layer, we have second fascia, superficial layer of the proper fascia. Deep layer of the proper fascia is not present here. After that, we have parietal layer of the endocervical fascia, which makes sheath for the vessels and the nerves of this triangle, and in this triangle is present the fifth fascia, prevertebral fascia. So when we talk about fascias, which fascias are located in carotid triangle, here we have first, second, parietal layer of the endocervical fascia, and fifth fascia. Content of the carotid triangle is common carotid artery, internal jugular vein, and vagus nerve. Common carotid artery is located more medially in the carotid triangle, and we see on the picture. Laterally to the common carotid artery is located internal jugular vein, and between vein and artery and behind the vessels is located the vagus nerve. Common carotid artery at the level of the superior border of thyroid cartilage is divided into external carotid artery and internal carotid artery. External carotid artery, which is located more medially in the carotid triangle, laterally to it is located internal carotid artery, and laterally to the artery is located the internal jugular vein. So, location of these vessels and the nerves in carotid triangle. In the inferior part of the triangle, so most medially, we have common carotid artery. It's the level of the superior border of thyroid cartilage, where common carotid artery gives off branches. So most medially we have external carotid artery, laterally to it we have internal carotid artery, most lateral is located internal jugular vein, and behind internal jugular vein and internal carotid artery is located the vagus nerve. Only external carotid artery gives off branches in carotid triangle. Internal carotid artery does not give branches in carotid triangles. When it leaves the carotid triangle, it passes through the carotid canal, and in the cranial cavity it gives off branches which takes part in formation of the Willis circle. This is clinically important. These two arteries are closely located to each other, very close. On the picture is also shown that it's closely located to each other. So when it's done the surgery for the purpose of accessing of external carotid artery, it is accessed in this triangle. So doctor knows that external carotid artery is located medially and internal laterally, but sometimes this artery so closely lies to each other, it's difficult to make difference which one is external and which one is internal. And this fact that external gives only branches here and internal does not give branches helps the doctor for make differences between these arteries. Branches which arises from external carotid artery. First branch of the external carotid artery is superior thyroid artery. Superior thyroid artery, so we have two, which supplies the thyroid gland. A branch of the external carotid artery is also lingual artery. This is lingual artery, which when arises from the external carotid artery, it passes in the submandibular triangle, and in submandibular triangle is located little triangle, Pyrogov's triangle. This is Pyrogov's triangle. When is needed the accessing this artery during the surgery, it is accessed in the this triangle, in the Pyrogov's triangle, which is bounded by mylohyoid muscle, posterior belly of digastric muscle, and superiorly it is bounded by hypoglossal nerve. Branch of the external carotid artery is also facial artery. Facial artery, when leaves the triangle, it passes in submandibular triangle, and from submandibular triangle it crosses lower margin of the mandible and enters on the face. It's one of the superficial arteries of the face. Also from external carotid artery arises occipital artery and posterior auricular artery. Occipital artery and posterior artery, auricular artery passes to the posterior part of the frontoparieto-occipital region, which supplies the superficial tissues of this region. Also from the external carotid artery arises ascending pharyngeal artery, which supplies the pharynx, and when it leaves the triangle, it passes through the parotid gland, we know this, and in the substance of the parotid gland, it gives off last branches. These are maxillary artery which passes into the deep region of the face. It is the main artery of the deep region of the face, and superficial temporal artery, which is termination of the external carotid artery. It is the largest branch of this artery, which enters the temporal region and supplies the superficial tissues of the temporal region. In the triangle, we have told that vagus nerve is located between internal jugular vein and the internal carotid artery and behind these vessels. Vagus nerve, and nerve also which passes in this triangle is hypoglossal nerve. Accessory nerve passes in the omotrapezius triangle. In the carotid triangle, branch of the accessory nerve and branch of the hypoglossal nerve forms the ansa cervicalis, which is located anteriorly to the vessels, anteriorly to the internal jugular vein and the carotid vessels. And then hypoglossal nerve passes in the submandibular triangle. We have told that it forms one of superior boundary of the Pyrogos triangle in submandibular triangle. Vagus nerve gives off branches, recurrent laryngeal nerves, which innervates the thyroid gland and the trachea. Except these organs, it innervates the vocal folds. In suprahyoid region, we have told we have it's the region which is located above the hyoid bone, so boundaries of the suprahyoid region, lower margin of the mandible. Inferiorly, it is bounded by the horizontal line which passes at the level of the hyoid bone, and laterally it is bounded by anterior borders of the sternocleidomastoideus mastoideus muscle. In suprahyoid region, we have two submandibular triangles and one submental triangle, which lies below the chin. Layers of the suprahyoid region are skin, subcutaneous tissue, superficial fascia, which makes compartment for platysma muscle. After this layer, in this region, we have superficial layer of the proper fascia. Deep layer of the proper fascia is not present here, endocervical fascia is not present here, and also prevertebral fascia we don't have here. So when we talk about fascias, in suprahyoid region we have only two fascias. These are superficial fascia and superficial layer of the proper fascia. In submandibular triangle, which is bounded by lower margin of the mandible, medially and anteriorly by anterior belly of digastric muscle and inferiorly by posterior belly of digastric muscle. So we have same layers, what we have told, which we have in suprahyoid region. So which layers? Skin, subcutaneous tissue, superficial fascia, superficial layer of the proper fascia. Floor of this triangle is formed by mylohyoid muscle and hypoglossus muscle. And in this triangle, we have told is located what little triangle, which is Pyrogos triangle. Here is shown this triangle, what we have told. So Pyrogos triangle, which is bounded by mylohyoid muscle, posterior belly of digastric muscle, and hypoglossal nerve. In this triangle passes the lingual artery. Vessels and the nerves, which is located in this triangle, we have facial artery and facial vein, cervical branch of the facial nerve, and also transverse cutaneous nerve of the cervical plexus. So facial artery, so we have told when it arises from external carotid artery, so it at first passes in submandibular triangle, which enters the face by crossing the lower margin of the mandible. Facial vein is the main vein of the superficial tissues of the facial part of the head. So when it leaves the facial part, so it passes in submandibular triangle, and from submandibular triangle it descends and drains into the internal jugular vein. Superficially, so through the platysma muscle, through the superficial fascia of this region is located cervical branch of the facial nerve, so fifth branch of the facial nerve, which provides innervation of the platysma muscle, and the cutaneous nerve of the cervical plexus is transverse cutaneous nerve. This is transverse cutaneous nerve, which comes from the cervical plexus, which provides innervation of the skin of this area. So cervical plexus, we have told, it is formed by union of the C1 to C4 cervical nerves. All these branches of the cervical plexus consist of cutaneous nerves, which innervates the skin of the neck region, and this branch transverse cervical nerve, so we have also in the submandibular triangle. In submandibular triangle is present also the submandibular gland, which lies into the sheath of the superficial layer of the proper fascia. We have told location of this fascia, and we have told also that this fascia, so second fascia, except making compartment for sternocleidomastoideus mastoideus muscle and trapezius muscle, it also covers and makes sheath for the submandibular gland. Submental triangle is located below the chin, which is bounded laterally by anterior bellies of digastric muscle. Inferiorly, it is bounded by hyoid bone, and floor of this triangle is formed by mylohyoid muscle. This is mylohyoid muscle. Layers. In this triangle, we have same layers as we have in suprahyoid region. So what skin, subcutaneous tissue, superficial fascia, which covers the platysma muscle, superficial layer of the proper fascia. Also, second fascia is present here. Between these fascias is located a superficial vein of the neck, which is anterior jugular vein. So anterior jugular vein, and this is anterior jugular vein, which takes origin from submental triangle, and in submental triangle it lies between these fascias. It descends down laterally to the midline of the neck, where we have two of these veins, and these veins are communicated to each other by jugular venous arch, which is located in the suprasternal space. Do we understand?
Yeah.
Main vessels and the nerves of the lateral triangle, we have told, is located in supraclavicular triangle. Let's remember where is located lateral triangle. This is lateral triangle, so which is bounded anteriorly by posterior border of sternocleidomastoideus muscle. Inferiorly, it is bounded by clavicle, and posteriorly it is bounded by trapezius muscle. In the lateral triangle, we have two triangles, supraclavicular and omotrapezius triangle. Supraclavicular triangle includes main vessels and nerves of the lateral triangle. Supraclavicular triangle, which is bounded inferiorly by clavicle, anteriorly and medially by posterior border of sternocleidomastoideus muscle, and superiorly it is bounded by inferior belly of omohyoid muscle. This triangle is covered by following layers: skin, subcutaneous dead tissue, superficial fascia, which makes compartment for platysma muscle. Platysma also lies here. Below this layer, we have a second fascia, so superficial layer of the proper fascia. Below it, we have deep layer of the proper fascia. And also in this triangle is present the prevertebral fascia, fifth fascia. Fifth fascia, and content of this triangle, we have subclavian vein, subclavian artery, and brachial plexus. Subclavian vein, subclavian artery, and brachial plexus. From anteriorly to the posterior side in this triangle, so most anteriorly is located the vein, behind and above the vein is located subclavian artery, and posteriorly to the artery is located the brachial plexus. Brachial plexus, which is formed by C5 to T1 nerves. Location of these vessels, this artery and brachial plexus, is in the muscular spaces which we have between the scalenus muscles. So except fat spaces, which is located between the fascias, we have muscular spaces on the neck, muscular spaces which is present between this scalenus muscle, and these muscular spaces lies where? Laterally. So as the muscles are lateral group of the muscles, so these spaces we have laterally on the neck region. We have three following muscular spaces. These are antescalenus space, which is located anteriorly to the scalenus anterior muscle. We have interscalenus space, which is located between scalenus anterior and the scalenus medius muscle, and we have scalenovertebral triangle, which is present between scalenus anterior muscle and longus colli muscle. Now, longus colli is removed from the picture, but we know that it is located anteriorly to the vertebra. So, scalenovertebral triangle is that area where passes the subclavian artery. Origin of the subclavian artery, we have two subclavian arteries, right and left subclavian artery. Right originates from the brachiocephalic trunk, left from arch of the aorta. So these vessels from thorax, when ascends upward through the neck, so, scalenovertebral triangle is that area where passes the first part of the subclavian artery, and after that it enters into the interscalenus space, which is located between scalenus anterior and medius muscle. So, according to its location, subclavian artery consists of three parts. First part is that area where it passes through this triangle. Second part lies in interscalenus space, and third part is located at the level of the first rib, where it continues to the axillary artery. Only first and second part of the subclavian artery gives off branches. Third part of the artery does not give branches, because that is that part where it continues to the axillary artery at the level of the first ribs. It so close lies to the bone that it makes this sulcus on the bone. First part of the artery branches which arises from the first part of the artery is vertebral arteries, and we see on the picture vertebral arteries which passes in the foramens of the vertebra. Then by foramen magnum this vertebral artery enters into the cranial cavity and it takes part in the formation of the Hillis circle which supplies the brain. Also, from the first part of the artery arises thyrocervical trunk, and this is thyrocervical trunk, which gives of three branches. It gives of inferior thyroid artery, superficial cervical artery, and suprascapular artery. Superior thyroid artery arises from external carotid artery, but inferior thyroid artery arises from thyrocervical trunk. So both superior and inferior thyroid arteries supplies the thyroid gland. And the largest branch of the subclavian artery is internal thoracic artery. Wait outside one moment. And largest branch of the this artery is internal thoracic artery, which passes into the thorax and gives off branches for the layers of the thorax. Second part of the subclavian artery is located in interscalenus space, we have told, and content of the interscalenus space, except the artery, we have brachial plexus, and we see on the picture. Second part of the artery gives off costocervical trunk. Now, here does not show this branch because calenus anterior covers, so other side is removed, this muscle, and the branch which arises from second part is costocervical trunk. Costocervical trunk. And third part, we have told, is located at the level of the first rib, which continues down to the axillary artery. So, content of the interscalenus space are second part of the subclavian artery and brachial plexus, and antescalenus space is the area which is located anteriorly to the scalenus anterior muscle. So this space will be posteriorly bounded by scalenus anterior muscle and anteriorly by infrahyoid muscles. Content which passes here is initial part of the common carotid artery, vagus nerve, and phrenic nerve passes in these muscular spaces. Superficial structures which we have on the neck region, we have external jugular vein, we have anterior jugular vein, so superficial veins, and cervical plexus, which is located in which layer? In the second and third fascia, between superficial layer and deep layer of the proper fascia. External jugular vein which is formed at the angle of the mandible by union of the retromandibular vein and posterior auricular vein. Obliquely it crosses anteriorly the sternocleidomastoideus mastoideus muscle, and then it drains into the subclavian vein. Anterior jugular vein, we have told, it is takes origin from submental triangle. We have two, passes down both sides of the midline of the neck, which are communicated to each other by jugular venous arch. And we have told the location of these veins clinically why is important, because outer wall of these veins is closely are connected to the fascias. Yeah, these veins when accidentally are damaged during the surgery, it can't be contracted itself. So if it is accidentally damaged, it must be immediately ligated, not to develop what? Air embolism. Superficially, in this layer, at the level of the sternocleidomastoideus muscle, we have cervical plexus. These are cervical plexus. We have told how is formed this plexus. It is formed by C1 to C4 nerves. Cervical nerves, which consist of cutaneous branches. It consists of lesser occipital nerve, greater auricular nerve, transverse cervical nerve, and supraclavicular nerve. So all these branches innervates the skin of the neck region. We have told and studied that lesser occipital nerve, except innervation of the skin of the neck, it innervates what? Posterior part of the frontoparietal occipital region. Greater auricular nerve supplies upper part of the skin of the neck region. Transverse cervical nerve transversely crosses anteriorly to the sternocleidomastoideus muscle, supplies skin of the neck region of this area, and its branches also passes into the submandibular triangle. So skin of that area is innervated by this nerve, and supraclavicular nerve innervates the lower part of the skin of the neck region, but it branches, descends below the clavicle and posteriorly to the scapular region. So skin of the scapular region and upper part of the thorax is also innervated by the supraclavicular nerves. Omotracheal triangle is located anteriorly below the hyoid bone. We have told that omotracheal triangle we have two. It is bounded laterally by superior belly of omohyoid muscle and anterior border of sternocleidomastoideus muscle, deeply by the trachea. Both these triangles anteriorly are communicated by midline of the neck, and deeply through this triangle we have all the organs of the neck region. Layers which we have in the omotracheal triangle here is present all the fascias of the neck region. First, second fascia, superficial layer of the proper fascia, a deep layer of the proper fascia, which makes compartment for infrahyoid muscles, parietal layer of the endocervical fascia, which lines this space where is located all the organs of the neck, and also here is located the prevertebral fascia. Now, one moment, now I share other presentation. Do we see now? Do we see the?
Yes, doctor, I can see.
So in this triangle, most anteriorly organs which we have in the triangle is the trachea. Most anteriorly is located the trachea. Behind the trachea is located the esophagus, and anteriorly to the trachea is located the thyroid gland. Trachea extends from cricoid cartilage to the sixth cervical vertebra. Trachea consists of two parts. cervical part and the thoracic part. So in the cervical part, it extends from cricoid cartilage to the C6 cervical vertebra, and after that it descends in the thorax region, and at the level of the T4-5 vertebra, it divides into the bronchi. It is cartilaginous organ, consists of cartilaginous cartilages, rings of these cartilages, anteriorly to which, at the level of the second, third trachea rings, is located isthmus of the thyroid gland. So second and third tracheal ring is crossed by the isthmus of the thyroid gland. Laterally, it is related to the lobes of the thyroid gland. Behind the trachea is located sulcuses, so between the trachea and esophagus we have sulcuses where passes recurrent laryngeal nerve, branches of the vagus nerve. We have told that vagus nerve gives off recurrent laryngeal nerves, and this recurrent laryngeal nerve is located through the sulcuses behind the trachea. Between trachea and esophagus, which innervates thyroid gland, and also it innervates the trachea. Except these organs, it also innervates the vocal fold. So during surgery, when it's done surgical intervention on the trachea, during tracheostomy operation, or on the thyroid gland during thyroidectomy operation, so carefully must be accessed this area not to damage the nerve, because damage of the recurrent laryngeal nerve may cause loss of voice. Aphonia may be developed in this case. So carefully must be manipulate that area where passes this nerve. Anteriorly, trachea in the lower part in the child is crossed closely by left brachiocephalic vein. It must be taken in consideration during inferior tracheostomy operation, not to damage this vein. Anteriorly to the trachea, below the isthmus of the thyroid gland is located pretracheal space, pretracheal space, which includes inferior thyroid veins. Also, in 20% of the body, here in this space may be located thyroidea ima artery. We have told that thyroid gland is supplied by two superior and two inferior thyroid arteries, but are cases in 20% of the body the gland is supplied by additional artery, which is thyroidea ima artery. If this artery is present in the body, it comes from arch of the aorta or from brachiocephalic trunk, and this artery is located in pretracheal space. So must be pay attention if this artery is located here during surgical intervention on the thyroid gland when it's ligated the superior and inferior thyroid arteries. Also must be looked for this artery, and if it is located here, it must be ligated. Trachea so is supplied by inferior thyroid arteries, which are branches of the thyroid cervical trunk from subclavian artery, and it is innervated by recurrent laryngeal nerves, which are branches of the vagus nerve. incisions, surgical excesses, which is performed, student, to the structures of the neck region. Only this I will tell you because we don't have time. Incisions, which is performed for accessing the structures of the neck region. We have different types of incision. Oblique incision, longitudinal incision, transverse incision, collar shape incision. So different types of incision is performed for accessing the structures of the neck region. So these incisions, one moment, now I share this. So combined incisions are used for accessing the structures of the neck region. Do we see this picture?
Yes, I can see it.
So longitudinal incision, which is performed on the midline of the neck, it's used during tracheostomy operation. Collar shape incision, which is performed between the medial edges of the sternocleidomastoideus mastoideus muscle, is used during thyroidectomy operation. Transverse incisions, two transverse incisions we have, which is performed above and parallel to the clavicle. This incision is used for accessing the subclavian vessels, artery and vein. And the superior transverse incision, which is performed in upper part of the neck region, it is performed parallel and below the lower margin of the mandible. This access is used for accessing the lingual artery in the submandibular triangle, exactly in Pyrogov's triangle. And the longitudinal incision anteriorly to the anterior border of the sternocleidomastoideus muscle, and we see it's used for accessing the carotid vessels in carotid triangle. And transverse incision also is performed for accessing the common carotid artery. And during surgery for accessing the structures and all that tissues, what we have told, which covers each triangle, is dissected for opening the triangle and for accessing the structures which is located in the triangle. Okay, we finish today. And the operational part we explain next lecture. Have we any question? Do we understand?
Yes, thank you so much, Doctor.
Okay, if we don't have questions, we finish.
Goodbye.
Goodbye.